Okay, we're joined by Dr. David Maloney. Doctor, thanks for taking the time to talk to us. You were in Prague this week, and you have some good news.
Yes, I was in Prague as part of the Mallow Primary Healthcare Centre group, who went to the World Congress of the World Organisation of General Practitioners. And there were several thousand people attending this, and it was quite a major event with people from all over the world. We brought some research from the Mallow Primary Healthcare Centre, and we were very pleased to win an award on the first day for a poster presentation of the research that we were doing on reasons for encounter. And on the second day, we had one on the carers course that was being provided for those who were providing care to dementia patients in the home.
So it's important to state that this was a worldwide event, and Irish researchers, specifically Mallow primary care researchers, scooped 2 awards. I don't think that's happened before, has it?
To my knowledge, no, I don't think it's happened before over the 20 years of the World Organisation.
Tell us a little bit about the research.
The research was based on reasons for encounter, and that's the reasons that people attend a doctor in the first place. So every time that somebody attended us and they had a complaint, or a cough or a headache or abdominal pain or fever, chills, we would just record that in a coded manner. And it's quite a simple format and just done during the consultation. It also helps put structure in the consultation, and we use it as a teaching tool for students and for young doctors in training. Mm-hmm. So as a result of this going on over a 2-year period, we collected the data, and we had 26,000 reasons that people would attend a doctor, and they presented over 20,000 times. And there were approximately 4,000 people presenting, and we had coded around 500 reasons why somebody would present to a doctor.
Okay. Now you've broken these down into age groups, so
yes.
They're age specific.
Yeah.
Take us through the main findings.
Well, I suppose the interesting findings, this was new research, and it is a new way of looking at things. And so one of the main findings was that the children presenting 0 to 15 present in exactly the same way with the same proportion of illnesses. So the group of 0 to 4 and 4 to 15 will present similarly and at the same percentage for different reasons. So we also found that once people hit 45, that the presentation of people of their illnesses over 45 is pretty similar all the way through the rest of their lives. Mm-hmm. But there's quite a difference between the children's presentations and the adults' presentations. Mm-hmm. And we noticed that the interim group, the 15 to 45 age group, had a very different pattern of presentation, where they were going from a childhood type illness presentation moving towards an adult type of presentation. And I think some of the situations that would have occurred is that at 15 onwards, people start presenting with musculoskeletal problems, whereas they're quite uncommon with young children. Mm-hmm. And we would have suspected this, but didn't have figures in this previously.
Very good. So in relation to the childhood presentations, what are the main ailments?
Well, the childhood presentations were mainly respiratory in the main. And you would have little or no psychological presentations, which would turn up later in life. Mm-hmm. One of the interesting findings was that throughout all the age groups, digestive problems turned up at approximately the same percentage and prevalence throughout the different groups, mm-hmm. So that they turned up as frequently in the different groups, mm-hmm. so that no matter what group you were in, you were just as likely to have the same degree of presentation of digestive problems.
Okay, you also found something interesting in relation to both public and private patients. What was that?
Well, I think this was something we always suspected anyhow, that people are people when they get sick, whether they're public or private. And we found there was no difference in the type of presentation that would occur between public and private patients, that they came and presented in exactly the same way. Mm-hmm. The only difference really was the frequency with which they would come. Mm-hmm. This obviously has to do with the new age where we have financial problems and serious difficulties, and people have to pay for their primary care medicine.
Absolutely. So what you're saying, in effect, is it doesn't really matter if you have money or don't have money, you're still going to get sick, pretty much at the same rate. And with the same things.
Yes, but you're less likely to turn up in a surgery if you have to pay for it than if you don't have to pay for it.
In the older age group, doctor, what was the main presenting symptom?
Well, in the older age group, we had a group of musculoskeletal problems were huge in the group, but there was a good distribution throughout all the symptoms, as you would expect, both respiratory and cardiovascular were obviously high presenters in those groups. And this is as you would expect, but it's the same presentation, and the rates of presentation were going through the different age groups after 45.
Just listening to you, it strikes me that general practice is, or appears to be, getting busier. However, if we're to listen to missives from the health watchdogs in this country, you would have the opposite opinion almost.
Right. Well, I think the prevalence, for the reasons for encounter, if we take those in particular, we know now that people are coming more frequently with more reasons to actually come into the doctor. So they're coming in, maybe storing up problems, and coming in with 3, 4 or 5 problems rather than presenting with just one problem on a consultation. We've also noticed, I did a paper with William Behan, which we presented on the at WONC as well, and this paper showed that the Central Statistic Office figures are probably in error since 2007, when they changed the telephonic recall, how they ask questions to find out how frequently people turned up. And they changed the question from asking people how frequently they visited a doctor within 2 weeks to asking them how frequently they came within 12 months. And the recall that people have is faulty. And we know from a corresponding paper that was also done by Dr. Behan that people will fail to recall about a third of their consultations. Now, this is quite a significant factor, and we've taken this factor and have extrapolated out from 2 practices that we merged, both my practice and Dr. Behan's practice. We merged them for statistical purposes, and they were representative of the national population as a percentage. And we found that the visiting rates were much higher than had been extrapolated in either 2007 or 2010 CSO figures.
Doctor, boil that down for us. Essentially, what are you saying with this?
What we're saying is that the CSO figures are approximately about 15 million consultations a year for the 2,500 GPs. We're saying that that figure is much higher. It's over 21 million consultations a year. And that the national statistics that people have been working on are faulty, and that they're not taking into account the actual work that is going on in primary care. So if you take the reasons for encounter, where we're looking at the type of consultation and complexity of which consultations are increasing, and the actual number of the consultations that are taking place in primary care, we now are getting quite a good view of consistent figures, which are telling us what the work is, the type of work that's been done, the complexity of the work that's been done, and the necessity to provide in primary care. And the primary care strategy, which is the national programme for delivering 90 to 95% of care through the primary care model, is absolutely necessary and is becoming much more important in its delivery.
Doctor, this is an important point, and we will no doubt hear more about this because it will have ramifications for the way general practice is governed by the health watchdog. Sum it up for us. Pull all the strands together in relation to the award from Prague. What does this say about Irish medical research?
Well, I think it's been a very pleasant experience from Mallow's point of view, but it says that general practice is computerised. We are capable, more than 90% of practitioners are now computerised. We are very capable of doing the new type of practice that's required to deliver the type of care that's going to change how people are treated into the future. And I think it also has the ability, it shows the ability to ease the workload on hospitals. And hence the primary care centres like ours are trying to look at the process whereby we deal with people, how we deal with them as they come through the door, provide the care to them from the start to the end, and from cradle to grave. And we're trying to deliver this new model into the future and assist the hospitals by taking people away from the hospital that don't need to go to hospital care, and therefore allow the hospitals to work more efficiently.
Dr. Maloney, thanks for taking the time.
Thank you.